It may come as a surprise, but frequent consumption of certain types of nuts can significantly increase your risk of heart disease, potentially by as much as 48%, particularly in older individuals. The figure in question is supported by findings from a longitudinal study published in the Journal of the American College of Cardiology, which spans several years. It is concerning that certain commonly found nuts in your kitchen may contribute to elevated blood pressure, promote inflammation, and lead to gastrointestinal obstruction. Certain nuts that are commonly perceived as beneficial for seniors may, in fact, pose risks to cardiovascular and cognitive health. There exists a specific nut, which will be identified subsequently, that contains a significant amount of a detrimental substance. Excessive consumption of this nut may adversely affect liver, kidney, and cognitive function. This particular nut may already be present in your collection of snacks, and it is often praised by individuals adhering to low-carbohydrate dietary regimens. However, it is important to note that it may be causing enduring harm to the elderly population. Rest assured, we will provide a comprehensive explanation in this video. This document serves as a comprehensive resource for the consumption of nuts. We will discuss the safety profiles of various options, their cardiovascular benefits, and their efficacy in supporting cognitive function. Additionally, we will provide guidance on which nuts to avoid. It is essential to remain engaged throughout the entirety of the presentation, as there will be a significant disclosure regarding a particularly hazardous nut that is often overlooked. This information may have implications for your health that you might not be aware of. Please remember to engage with this video and subscribe to our channel for additional informative content before we proceed. Please provide a comment indicating your location of participation. Let us examine the 4 varieties of nuts that are particularly beneficial for the elderly population. Initially, we have almonds, which serve as an excellent option for promoting bone health. These foods are rich in calcium and vitamin E, which are essential for maintaining bone strength. With advancing age, there is a tendency for bone density to decrease, resulting in increased fragility and a higher risk of fractures, which can subsequently lead to significant complications. Following the age of 65, there is a notable increase in the rate of natural bone loss. However, incorporating a modest quantity of almonds into your dietary regimen may provide significant benefits. Consuming a cup of almonds daily may contribute to a deceleration of certain physiological processes, as they provide approximately 97 mg of calcium. Almonds are a rich source of calcium and also contain magnesium, a nutrient that is often insufficient in the diets of older adults. Almonds are distinguished by their magnesium content, which plays a crucial role in facilitating the transport of calcium. This process prevents calcium from adversely affecting the arteries and ensures its delivery to the bones where it is needed. Additionally, the beneficial fats present in almonds may contribute to cardiovascular health by decreasing levels of low-density lipoprotein, LDL cholesterol, a crucial factor in mitigating the risk of heart disease. As individuals age, it is advisable to consume approximately 15 to 20 almonds daily, preferably in their raw or dry-roasted form without added salt. Almonds are beneficial for alleviating constipation due to their high fiber content, providing approximately 3.5 grams per serving. Constipation is a significant concern, impacting approximately 40% of the elderly population. Additionally, findings from Tufts University indicate that almonds may play a role in safeguarding brain cells from oxidative damage associated with aging. It is advisable to consider incorporating almonds into your dietary regimen. It is advisable to consume almonds with their skins, as they contain flavonoids that, in conjunction with vitamin E, enhance the antioxidant capacity of the almonds. However, it is important to note that almonds may pose a choking risk for older adults with swallowing difficulties, so thorough mastication is recommended. Regarding walnuts, they are beneficial for cognitive function, and their resemblance to the brain is quite appropriate, given their supportive role for this organ. Walnuts are considered one of the most beneficial foods for brain health in the elderly. Walnuts serve as an excellent source of plant-derived omega-3 fatty acids, particularly alpha-linolenic acid, and have been shown to offer greater cognitive benefits for the elderly in comparison to other commonly consumed nuts. Omega-3 fatty acids play a crucial role in facilitating communication within the brain and maintaining the integrity of neuronal cell membranes. A recent study published in the Journal of Nutrition indicated that older adults who consumed 1.5 ounces of walnuts daily for a duration of 8 weeks exhibited significant enhancements in cognitive speed and flexibility. The distinctive polyphenolic compounds present in walnuts may significantly contribute to that enhancement. Walnuts have been shown to potentially slow the progression of neurodegenerative diseases, such as Alzheimer's and dementia, by crossing the blood-brain barrier and mitigating inflammation within the brain. It is important to note that walnuts also contain melatonin, a hormone whose levels typically decline with age, leading to sleep disturbances in many older adults. Some individuals report that consuming a handful of walnuts prior to sleep may enhance their sleep quality. Additionally, walnuts are a source of arginine, an amino acid that contributes to vascular health, as well as polyphenols. Incorporating walnuts into your diet may contribute to a reduction in oxidative stress, thereby promoting cardiovascular health. They may enhance the efficacy of antihypertensive medications by assisting older individuals in maintaining arterial flexibility. It is advisable to store walnuts in a refrigerated environment to inhibit the degradation of their oils. Additionally, a daily intake of 7 to 9 halves is recommended for optimal health benefits. Additionally, engaging in the activity of cracking them open independently may contribute to the maintenance of your fine motor skills, so it is advisable to consider attempting it. Walnuts possess a distinct protective flavor profile, and the subtle bitterness present indicates a high concentration of antioxidants. Pistachios have been shown to be beneficial in the management of blood pressure levels. Pistachios are frequently underestimated when considering nuts that contribute positively to the health of seniors. However, they play a significant role in maintaining optimal blood pressure levels. Pistachios are distinguished by their low sodium content and high potassium levels, providing approximately 285 mg per serving, making them an excellent option for a nutritious snack. The equilibrium of minerals is precisely accurate. It is particularly crucial for the elderly, as it aids in preventing the kidneys from retaining excess sodium. With advancing age, there is a potential for a reduction in systolic blood pressure by 3 to 5 points, comparable to certain prescription medications, yet devoid of adverse side effects. Additionally, it is important to highlight the role of pistachios, lutein, and zeaxanthin, as these carotenoids contribute to the protection against age-related macular degeneration, a primary cause of vision loss in individuals over the age of 60. By concentrating on the health of the macula in the eye, older adults can significantly enhance their quality of life. Consuming pistachios can be a pleasurable experience, as they are less likely to adversely affect your dental health compared to harder nuts. Additionally, their distinctive green and purple hues are visually appealing, and they are rich in antioxidants that combat free radicals, which can accelerate the aging process. Pistachios are an excellent choice for the elderly, as they assist in preventing overeating and provide a mindful snacking experience that is both calming and beneficial for cognitive function. The act of shelling pistachios may prolong the snacking process, which can assist individuals in monitoring their consumption more effectively. The International Journal of Obesity has indicated that the empty shells function as a visual cue for the elderly population. Individuals with arthritis who experience difficulty in shelling pistachios may consider selecting those that are already partially opened. It is advisable to consume approximately 49 pistachios daily, which equates to about 1 ounce of unsalted or lightly salted varieties. This is particularly significant for the 25% of the American population aged 65 and older who are diagnosed with diabetes. Individuals with prediabetes may find that the 3 grams of fiber present in each ounce of pistachios can assist in maintaining stable blood sugar levels. Brazil nuts are highly regarded for their beneficial effects on thyroid health, an aspect that is crucial yet frequently neglected as individuals progress in age. One Brazil nut provides 96 micrograms of selenium, which accounts for 137% of the recommended daily intake. These nuts represent an excellent source of selenium available. Many thyroid disorders remain unaddressed, as their manifestations may be mistaken for typical age-related changes. The significance of this matter cannot be overstated, as thyroid disorders impact approximately 20% of individuals aged 65 and older. Selenium, abundant in Brazil nuts, plays a crucial role in the activation of thyroid hormones, thereby contributing to energy levels, metabolic processes, and mood regulation. Additionally, the unique fatty acids present in Brazil nuts contribute to the protection of myelin, the insulating layer surrounding nerve cells, which is known to diminish with age. This indicates that older individuals may maintain their reflexes, reaction times, and cognitive processing speeds at a heightened level. The myelin maintenance provided by selenium in Brazil nuts is noteworthy, as it is naturally bonded, facilitating its utilization by the body more effectively than synthetic selenium tablets. Brazil nuts possess significant nutritional potency, allowing for the consumption of only a small quantity to experience their health benefits. Their rich and creamy texture enhances the enjoyment of even minimal servings. It is advisable for older individuals to limit their intake of Brazil nuts to 1 or 2 per day, as excessive selenium consumption may lead to adverse effects. When selecting Brazil nuts, it is important to consider this factor. Select those that remain in their shells, as this natural packaging aids in preserving the nutrients for an extended period and mitigates spoilage due to their elevated fat content. It is advisable to store them in the refrigerator. Brazil nuts are rich in fiber and beneficial oils that promote regular digestion, which can be particularly advantageous for older adults experiencing constipation. Many seniors tend to choose less nutritious snacks. However, these nuts serve as an excellent alternative due to their naturally sweet and buttery flavor. Recent studies indicate that certain antioxidants found in Brazil nuts may contribute to the deceleration of telomere shortening. Telomeres serve as protective caps on chromosomes, and their reduction is associated with cellular aging processes. Individuals aged 65 and above may find these nuts to be highly beneficial for their health. In this section, we will discuss certain nuts that may be advisable for older individuals to avoid or consume with caution, such as peanuts. Despite their popularity, peanuts may pose risks for many older adults due to potential complications they can induce. It is important to note that peanuts are not classified as true nuts. Rather, they are legumes that develop beneath the soil surface. This condition renders individuals particularly vulnerable to mold and aflatoxins, which are toxic compounds generated by specific molds. Prolonged exposure to or consumption of these toxins can adversely affect liver function and potentially elevate the risk of cancer. With advancing age, the body's efficiency in detoxification diminishes, thereby increasing the associated risks. Additionally, peanuts contain proteins that may induce inflammatory responses. It is possible for individuals to experience reactions even in the absence of a clinically confirmed allergy. Individuals of advanced age are predisposed to conditions such as joint pain, cardiovascular issues, and cognitive decline. The presence of low-grade inflammation can exacerbate these existing health concerns. A significant portion of the American population consumes an excessive amount of omega-6 fatty acids in relation to the beneficial omega-3 fatty acids. Peanuts, in particular, contain a high level of omega-6, which exacerbates this imbalance. Many healthcare providers do not adequately inform their elderly patients about the potential hazardous interactions they should be vigilant about. Peanuts and anticoagulants such as warfarin may interact adversely due to the presence of vitamin K in peanuts. Additionally, the presence of hydrogenated oils, excessive sodium, and added sugars in commercially available peanut butter can exacerbate health concerns for elderly individuals with cardiovascular conditions. Given that 63% of American seniors are currently managing high blood pressure, it is crucial to minimize additional stressors in their lives. Natural peanut butter, even in the absence of added salt, has the potential to elevate blood pressure levels. Improper storage of peanuts can lead to spoilage, resulting in the formation of harmful free radicals, which presents an additional concern. The conventional methods of desiccation do not yield beneficial results. The process of roasting peanuts for commercial purposes has the potential to produce acrylamide, a compound that may have implications for cognitive function. This situation is concerning, particularly for individuals who are already experiencing anxiety regarding memory-related challenges. Even if you have been consuming peanuts regularly without any adverse effects, incorporating one of our suggested nuts into your diet for just 3 days a week can offer vital nutrients while minimizing your exposure to potentially harmful substances. It is important to consider the potential for cashews to induce a rise in blood sugar levels, which may not always be immediately apparent. Cashews contain a significant amount of carbohydrates, which can lead to elevated blood sugar levels, a notable concern for the elderly population. The fiber content is significantly lower, while the carbohydrate content is notably higher, approximately 9 grams per ounce, in comparison to other nuts. Approximately 25% of individuals aged 65 and older are diagnosed with diabetes, while an additional 48% fall into the prediabetic category. This may result in a potentially hazardous glycemic response. The situation is particularly concerning, as cashews are frequently perceived as a healthy option, leading many seniors to consume them in excess without being aware of the implications. Cashews have the potential to significantly impact your blood glucose levels. Their smooth, curved morphology presents a potential choking risk, particularly for individuals with dysphagia. These nuts are among the most commonly associated with choking incidents in the elderly population. Additionally, from a nutritional standpoint, cashews may not be the optimal selection due to their high oxalate content. These substances have the potential to bind with calcium in the gastrointestinal tract, thereby impeding the absorption of this essential mineral. This is particularly concerning for the elderly population, who are already at an increased risk for osteoporosis. The likelihood of developing kidney stones significantly increases after the age of 60, primarily due to the presence of oxalates. Additionally, there exists another underlying concern regarding the processing of cashews. The extensive processing required to eliminate urushiol, a toxic compound found in poison ivy, results in a significant loss of nutrients. Numerous commercially available cashews undergo oil roasting and are often heavily salted, contributing unhealthy fats and elevated sodium levels that may exacerbate hypertension and cardiovascular issues. Additionally, cashews contain enzyme inhibitors. The process of protein digestion can present significant challenges, particularly in the elderly population, who frequently experience difficulties in both the consumption and absorption of protein. Many individuals may not be aware that one factor contributing to weight gain with advancing age is the creamy texture of cashews, which can lead to excessive consumption. Consider incorporating walnuts or almonds in place of cashews on a regular basis. These snacks are designed to be more beneficial for aging bodies, providing essential advantages while promoting overall health. Macadamia nuts are quite palatable. However, they possess a significant caloric density, containing approximately 200 calories per ounce, which categorizes them as the most calorie-rich nut available. In the elderly population, this presents a significant health concern, as metabolic rates tend to decline with age, complicating weight management efforts. Additionally, the impaired function of the gallbladder may exacerbate the effects of the high fat content present in these nuts. Consumption of merely 22 grams of macadamia nuts has the potential to induce painful episodes in approximately 15% of elderly individuals who may be unaware of their gallstone condition. Additionally, these nuts are high in caloric content and possess one of the highest levels of saturated fat, approximately 3 grams per ounce, which may contribute to elevated LDL cholesterol levels. Many elderly individuals are expressing concerns regarding that matter. Furthermore, due to their density and hardness, these substances pose a significant risk to the dental health of elderly individuals who have crowns, bridges, or compromised teeth. This presents a significant concern for them. Individuals aged 65 and older frequently experience diminished enamel strength due to wear and reduced calcium absorption. Macadamia nuts are among the most expensive varieties available on the market. This may lead older adults who are aiming to reduce expenses to select less expensive nut varieties that are more susceptible to spoilage or improper storage conditions. This places them at an increased risk of ingesting detrimental oxidized fats. Furthermore, the nutritional profile of commercially available macadamia nuts is suboptimal, as they frequently contain elevated levels of sodium and unhealthy fats due to excessive oil roasting. Salted macadamia nuts possess a rich, buttery flavor profile that may lead to excessive consumption, particularly among older individuals who typically favor more pronounced tastes. It is noteworthy that a significant number of elderly individuals consume macadamia nuts under the impression that they are benefiting their cardiovascular health. However, the majority of research concerning nuts and heart health often fails to adequately address the effects of high-fat varieties, such as macadamias. Conversely, pistachios exhibit a significantly more favorable nutritional composition that is beneficial for the aging population. Therefore, if you have a preference for macadamia nuts, it may be beneficial to consider incorporating pine nuts into your diet as an alternative. The consumption of pine nuts may lead to significant health concerns, particularly among the elderly population. The presence of certain chemicals can interfere with over 60% of medications commonly prescribed to the elderly, which is a significant concern. This may indicate that the medications may not be as effective or could result in adverse side effects. Numerous prescription medications can interact adversely with one another, particularly statins, certain antidepressants, and antihypertensive agents in individuals aged 65 and older. It is concerning that many healthcare providers, including physicians and pharmacists, often do not adequately inform their patients about the potential risks associated with food and drug interactions, as this is a significant issue that warrants attention. Pine nut sickness is a significant concern as it results in a persistent bitter and metallic taste in pine nuts for several weeks following consumption. While this may appear to be a minor issue, it is, in fact, more serious than it seems. Changes in taste perception can significantly impact the nutritional intake of older adults, potentially resulting in decreased appetite and compromised nutritional status. Studies indicate that approximately 42% of individuals impacted may experience substantial weight loss. This syndrome appears to be more prevalent among the elderly population, potentially attributable to alterations in taste perception and detoxification mechanisms associated with the aging process. Pine nuts contain a significant amount of polyunsaturated fats, which are susceptible to oxidation and may lead to inflammatory responses in the body. The presence of chemicals can pose significant challenges for elderly individuals who are already managing inflammatory conditions such as arthritis. The presence of these small, slippery particles poses a potential choking risk, particularly for elderly individuals who may experience difficulties with swallowing or are taking medications that contribute to xerostomia. This condition is prevalent, impacting more than 70% of elderly individuals who are on various medications. Furthermore, with advancing age, the body's ability to absorb proteins diminishes, and the presence of enzyme inhibitors in pine nuts may further complicate the digestion of proteins. Pine nuts possess a high caloric density, which may impact weight management in individuals over the age of 65 due to their substantial oil content. Recent studies indicate that certain varieties of pine nuts, commonly found in dishes such as pesto, may be associated with an accelerated progression of age-related macular degeneration, a leading cause of vision impairment in the elderly population. Individuals aged 65 and older should consider refraining from the consumption of these nuts to promote optimal health, energy levels, and cognitive function. The dietary choices made regarding nut consumption can significantly impact overall well-being in later years. It is important to recognize that implementing minor adjustments on a regular basis can culminate in significant outcomes over an extended period. At this juncture, it is pertinent to inquire whether there is empirical evidence supporting the notion that dietary modifications, such as the inclusion or exclusion of specific nuts, have an impact on health outcomes. Please share which type of nut has had the most significant impact on your health and well-being in the comments section. We value your input.